and welcome to the World Economic Forum on Africa. We're here bright and blustery on the second day of the meeting here in Cape Town. It's the first issue briefing of the day, and the topic is on vaccines and trust in medical experts. Today we're going to talk about the Global Monitor. It's the largest ever global study of public attitudes to science and health, published by the Wellcome Trust. It details the findings across Africa, which show overall that trust and engagement with science and health is low across Africa. In fact, 16 of the 20 global countries with the lowest trust are in Africa. However, it also finds that the picture is more positive about vaccines. So we're very happy to be joined here today by 4 experts on science and vaccines. We've got Jeremy Farrar, who is director of the Wellcome Trust, the health charity behind the survey. We have Dr. Priya Agrawal, Managing Director, South Africa, Sub-Saharan Africa at MSD, the pharmaceutical company. We have Professor Thumbi Ndung'u, Deputy Director of Africa Health Research Institute, and Dr. Neema Kaseje, a surgeon with Médecins Sans Frontières and a specialist in public health. So before we get started, this session is going to take roughly 30 minutes. We'll hear from our panelists for the first 15 minutes, and after that, we'll open up to the floor for questions. Jeremy, let's start with you. Can you tell us about the Global Monitor and what you found to be the key findings?
Yeah, thanks very much, and very warm welcome to everybody. I'm the head of the Wellcome Trust, and what we seek to do is to bring 3 things together, which we think are critical to making the world a better place. That is science, innovation, and putting that in the context of society. And the third element of that, society, is absolutely critical. There's no doubt the world faces enormous challenges, from climate change to drug resistance to Ebola in DRC at the moment, and a range of other issues. Science doesn't have all the answers, but it has some of the answers. But if you don't innovate that science, and you then don't put that in the context of the societies and the communities in which it's operating, then it doesn't matter how good the science is, you will never achieve the impacts that you wish. And obviously, the horrific epidemic of Ebola at the moment in DRC is a really good example of that. I've been in DRC twice in the last few months. We have a vaccine, we now have a treatment, and yet still the community, for reasons that are very clear, are not willing to accept those interventions. And that's just a microcosm of what we face both across the continent, actually, and across the world, with the increasing skepticism about issues like climate change or the benefits of vaccines, which have saved millions of lives. So if we keep science in a silo, in an ivory tower, and we don't make that part of the societies in which it has to thrive, then our endeavors in the science will fail. And that's what Wellcome is about. And I think the Global Monitor, the biggest ever survey, 140,000 people in, I think, 140 countries all around the world, 40 countries in Africa, gives you an incredible rich data source which is open to everybody to look at, to ask what is it that people trust, what don't they trust and why, and how do we link those better so that the the wonderful golden era that we're going through in science has the ability to have the maximum impact on the maximum number of people independent of their ability to pay, so to make sure that it's accessible to everybody. That's, I think, the summary for me.
Lovely. And what drove you to conduct the survey in the first place?
Well, it goes back to these 3 pillars, which is what, in my 5 years at Wellcome, we've tried to base what we do as the world's second largest charity, which is science, innovation, and society. And the Global Monitor, for me, speaks to the societal element, but links both to science and to innovation. And we cannot do that alone. We cannot do that without the communities we work with. We cannot do it without academia. We cannot do it without other partners from the NGO sector. And we cannot critically do that without industry and government. And it's bringing those together that is going to enable us to address the issues of the 21st century.
So about 1/5 of the people in Africa don't have any trust in science or medicine, as the survey has found. So what can you do about it? Neema, you work on the front line of public healthcare. You're a surgeon with Médecins Sans Frontières. You've seen disease and epidemics and outbreaks firsthand. So what does this lack of trust look like on the ground to you?
Well, First of all, thank you for the opportunity to be here, and it's a pleasure to meet my co-panelists and to participate in this discussion. The first point I'd like to make is that it's absolutely impossible to provide health and medical care when there is no trust. So I'd like to pick up on what Dr. Farrar said and said it's really essential. If there's no trust, they will not come to you. So that's number one. They will remain in their communities and they will die from whatever disease they're suffering from. Once they get to the hospital, if there's no trust, there's no way you can have a discussion. There's no way you'll actually find out what's going on between you and the patient. When it comes to the diagnosis, if there is no trust, they would not believe what you tell them is going on. If there is no trust, they would not go ahead with the treatment. So it's absolutely fundamental. Trust is fundamental. And if there's no trust, the whole system crumbles and nothing will function. And so it's something that we see in epidemics. We're seeing it with how people are reacting to vaccines right now. We're seeing it in day-to-day clinical care with our patients. And it's something that needs to be addressed very quickly and quite aggressively because we're going to lose ground.
Dr. Ndung'u, just to bring this back to you, so you work in vaccine research in KwaZulu-Natal, and you have this experience pretty much on a daily basis, don't you, where you're trying to increase trust in vaccines and you're involved in a lot of public engagement in order to affect that. Can you tell us a little bit about your daily experience?
Yeah, I work in, so thank you very much again. Also a pleasure to be here and to participate in this discussion. Yeah, so first of all, I work in KwaZulu-Natal here in South Africa. This is an area with very high rates of HIV infection as well as TB. These are our two biggest public health challenges in KwaZulu-Natal and in South Africa in general. And I think that what we have seen with the HIV epidemic in particular is a situation where maybe the science has been ahead of the community in many ways, in the sense that we have some solutions for this huge problem, but the uptake of the solutions for this problem hasn't been as great. So there is a disconnect between scientific advances that we have made versus the uptake and acceptance of those advances by the communities that we work with. And I think that this obviously speaks to some of the issues that Dr. Farrar highlighted in terms of making a connection between the science and communities and making sure that we are not doing a science that is separate and siloed from the community. I think for me it speaks to the need for us to engage with communities right from when the science is being conceived in terms of what kind of interventions we want to put in place in the communities, right to when the science is actually, or the research is being done to develop the solutions in order to continuously engage with the communities and ask, what is it that is likely to lead to acceptance and to the solution to the problem? If we don't do that, we will end up with solutions that are there on the shelf that people are not using. And unfortunately, we are seeing that with the HIV epidemic and to an extent with TB. So I think there's a need for public engagement and community engagement, but also for inclusivity and diversity in science. We need to, the days when scientists kind of worked somewhere in a corner by themselves and came up with solutions and expect that people in the general community will then take up those solutions and implement them are long gone. What we need is to engage, but also to be inclusive and to have diversity so that the people that are actually coming up with the solutions, some of those people are coming from those communities, and that will lead to much faster acceptance of the solution and to much faster resolution of the public health problems that we face.
Priya, you work for a vaccines company, so you know that vaccines work. And yet, because you're a pharmaceutical company, you're dealing with a lack of trust amongst communities. So what are you doing to address this lack of trust of science and vaccines?
Thank you. So first of all, thank you very much for the report. I think as a research-based pharmaceutical company, we're pushing the boundaries of science every day and have been doing so for 125 years, whether it's the Ebola vaccine, the measles vaccine, in the hope and expectation that we'll invent life-saving medicines and vaccines. But as my panelists have said, there's no point having these drugs and these vaccines sitting on the shelf or in a lab if distrust means people don't actually use them. So I think the findings of this report I see as a bit of a warning shot, because we used to think that vaccine hesitancy was a sort of a rich man's luxury, right? You see UK losing its measles elimination badge, France, real severe lack of confidence in things like vaccines. But actually, you know, WHO has said vaccine hesitancy is one of the most important threats to global health. And in DRC, as many of you know, in June of this year, we had 87,000 cases of measles, 1,500 lives lost due to measles vaccine. So I think, well, due to not taking the measles vaccine, right? And so I think when it comes to what are we doing, you've heard some of the solutions, but we have to invest in the communities and the frontline workers. So we have a huge program around capacity building, ensuring that our frontline workers know how to answer the question, is this good for me? Is this safe for me? I can tell you, both as a physician, as a patient, when you ask that question, you don't want to be told, I'll come back to you. That doesn't instill confidence. The other thing is ensuring that there are national champions in countries. We had a great example in UAE, for example, where there was a mummy group and they were discussing about a particular vaccine. I don't think this is safe. And the sheikh joined the social media conversation to say, this vaccine's important, please take it. The other thing is in terms of scientists like Professor Ndung'u, how do we actually enable them to talk about science in a way that makes sense for the public? Right? We've been doing that for 125 years, so we're doing a lot of capacity building and communication. I'd say a lot of those are traditional sources of information. We also have to recognize that there are lots of non-traditional sources of information. We're having an information overload right now, and we have to recognize that people do go to Facebook or Google. So there's responsible sort of Google searching that you can do now. So if you look up, you know, is this vaccine effective? In some places you can ensure the first thing that comes up is a public health agency report. We're doing a lot of social listening to understand what's going on. And then, of course, everyone in this room and those that are listening, we do need responsible and balanced reporting on these issues. So I think there's a lot that can be done, but the most important thing is we all have to work together to ensure that there is trust in the science and in the life-saving vaccines.
So that brings us to the next question. Jeremy, would you like to answer, what is the role of the media when it comes to reporting on vaccines?
So the media's got an absolutely critical role in this, and one of the media's roles, as I see it, not coming from the media, is to hold people to account, and that's perfectly reasonable. Nobody's asking the media to report good news stories. We're asking the media just to be balanced and to trust information, to challenge that information and question it, and to give to the community and the public trustworthy, honest, evidence-based information. That's all we ask. We're not asking for special status. We're not asking for special reporting or anything else. We're just asking for that honest dialogue and to be challenged. And scientists, I think, across from industry through academia into the NGO sector have also got to be willing to see media not as a negative, but as a partner in this, and be willing to be challenged by it, but be comfortable talking to the media and engaging with the media, because they are part of this system just as we are.
And one final question. So who is the survey for, and what do you hope will happen with this data?
For us, the survey is for everybody. I mean, we're absolutely committed to everything being open and transparent. All of the data is and will be available for everybody to analyse in whatever way they wish. We don't want to keep anything closed. We don't want to hide anything. We will repeat it over time, because I think one of the crucial elements is how things are changing. Some of the figures, some of the data looks very encouraging, as we've heard. but there are some really warning signs. 27% of people on the continent don't trust their clinics, hospitals, and clinicians, whoever, paramedics, nurses, whatever. That's an incredibly worrying trend. And if that were to continue, with the challenges the continent and the rest of the world faces in terms of both infectious and non-infectious diseases over the next 20 years, that's a really worrying statistic.
So shall we open this up to the floor? If there's anybody who has a question, would you like to speak now? To get the mic to that lady, please. Thanks. Could you tell us your name and organisation first, please?
Hi, my name is Tamar Khan. I'm a reporter with a South African newspaper called Business Day. My first question is a general one. You mentioned that 27% of people in Africa don't trust their clinics, doctors, etc. To what extent have you drilled down into the reasons for this? I mean, people may not trust their clinics because they just don't have the medicines they need when they arrive there. So really just to tease that out. And secondly, because I'm writing for a South African audience, can you unpack the findings, what you've learned about South Africa specifically with regard to vaccines and vaccine hesitancy, please?
Who'd like to answer that question?
Can I just take the first one? Because I think what's also critical in the report is to both look at the bigger picture and the detail. And the 27% that's quoted there around clinics, actually that is also linked to trust in institutions generally. Either trust in the court system, in the police, in the government, in all sorts of institutions. And it's a little bit difficult to disaggregate specific issues and say it's this clinic or that clinic. Your point about a mother, a child, a father, a grandfather, whatever it is, going to a clinic and finding that there isn't a test there is no drug on the shelf, and if there is, it may be out of date. You know, if we allow that to be the public health system that our societies operate in, we cannot expect the community to trust it. And there is no public health without the trust and engagement of the community. Those two things are indivisible. You can't separate them. And if we don't have that trust, and we've had it, we've been very lucky, we've had it for many, many decades. I think what the Global Monitor shows you is it's fragile, it's fragmented, and it could be lost very quickly. The South African data, sorry, we would have to drill down that probably afterwards is better, specifically on South Africa.
So there's plenty of numbers in the report, and there's a handout there with many of them on it. So we have another question over there. Microphone is coming. Thank you.
My name is Ralf Krüger. I'm working for DPA, German press agency. You were telling us that a lot of Africans don't believe in health experts. Now, I would like to know, what are they believing in instead of?
George, take that. If they're not believing in health experts, who are they believing? I think that would be the question.
Yeah. Shall I take it on?
Yeah, you can.
No. Okay, I'll go ahead. I think it's really more a reflection of the gap and the silo that you spoke about and the ivory tower. The fact that we are in our labs or in our hospitals and we never actually go to the communities. I actually, as a surgeon, I'm a surgeon, but I do leave the operating room and I spend a lot of time in the communities because it gives me a lot of information and I get to speak to the people to figure out, well, what are their priorities? What are their concerns? Are we providing services that are acceptable to them, that fit their needs? And so that's absolutely critical. So I think I would reframe that as not really them not believing, but I think it's more of them not understanding and a reflection of the distance between our community and the communities that we serve. And we need to do more in terms of getting those two worlds together. And so, for instance, in Kenya, we started a leadership training program for girls who want to be scientists, and we get scientists together and with the girls so that the girls can actually interact with them and figure out, well, what do they do on a day-to-day basis? So that hits a few points: the youth, the understanding, the exchange between the two communities, the scientific community and the communities that are being served. you.
Can I just, I think it's a really important question that, you know, scientists love to describe problems, but what we've got to do more is try and think what the solutions are. And I think your question gets to the heart of what the challenge of the Global Monitor does to us. And there has been, as you probably know, and in fact some of it comes from Germany, a lot of work on where trust is built in today's societies. And it is more at a peer group and amongst your friends, family, and your peer group that a lot of trust now rests. And of course, within those peer groups, there are key individuals and key groups and organizations that will drive information and behavior. And that is part of the social media revolution. And so I think we have to appreciate that the top-down approach from institutions, from governments, and others will not necessarily work in the way in the future it has in the past. And that we have to think about how that more networked, more fragmented set of societies operate and how best to engage and inform those individuals and groups.
Can I just add something? Just to build on that, as part of an initiative that we have called MSD for Mothers, it's a sort of a $500 million initiative focused on maternal health, but really it's focused on health system strengthening. And so we've got programs in sort of Senegal, Uganda, Tanzania, Kenya, etc. What we've found, there's two lots. So there's the peer group. So, you know, when we've been using digital technology in countries like Kenya to engage around family planning choices and counseling, the amount of engagement we're seeing from both women and men and broader than family planning has been very interesting. They want to engage in an anonymous way and get input from their peers and families, like Jeremy was saying. The other part of society that I think we often forget are the informal providers, the people sort of in the blind spot. So there's the public institutions, but if you look at a total market approach, there's a lot of informal providers in these countries that actually are your first frontline worker that they approach. And often donor-funded programs and government-funded programs don't work with these informal providers. And so by working with them, we've realized that they are the first point of information. And if you can increase awareness, education, and quality of those frontline providers, then actually you're going to reach these communities faster than if you just work with your formal government-funded, donor-funded institutions. So I think we need to start really understanding those trust patterns and investing in those sort of other aspects of the community than the usual traditional sources.
Maybe I can also just quickly add, I think that in Africa, I think it is true that Africa does suffer from having weak institutions. And I think it's difficult for people and communities to engage and trust when the institutions are weak. You know, if people go to hospitals and most of the time they can't find drugs that they need for the conditions that took them there, I think that's going to result in, you know, erosion of trust. And so I think that there is a need for African governments and scientists and other stakeholders to figure out how do we strengthen institutions so that they actually deliver the services that they have been set up to do in an empowered way, in a sustainable and continuous way, and that I think will generate more trust. But I also want to add quickly that I think one of the problems I think we have, again, is that there has been a lot of emphasis, I think, with institutions, particularly healthcare institutions, to emphasize the technical skills that are needed to run those institutions. So, you know, the doctors, you know, they need to have trained doctors and nurses, but actually what kind of service are people getting? I mean, when people get to those institutions, do they feel welcome there? Do they feel part of those institutions? Do they feel any ownership of those institutions, or are they treated badly in a way that then leads to erosion of trust? So I think there is a huge task here on multiple levels, both to strengthen the institutions, but to also ensure that it's not just the technical skills that are being are being empowered, but also the engagement sort of skills, the soft skills that are needed to actually make these institutions attractive to people so that people can go to these institutions and use the services when they are there. But, you know, also engaging in you know, during the entire research process to make sure that the products that are being developed to address the healthcare the problems are in fact the kind of solutions that people need. And actually vaccines are a great example of that, because in sub-Saharan Africa in particular, vaccines have been very, very effective as a public health strategy, and there is a lot of acceptance of vaccines as a solution, and it comes out in this report that a lot of people have a very positive predisposition towards vaccines. So we need to, for example, in my opinion, invest more in solutions like that, like vaccines, which people already have trust in, as opposed to other solutions that people have less trust in.
Thank you. I think we might have just enough time for one more question. Over here. Thank you.
I'm Tumuleng from Channels Television News. The question I've got is specifically towards malaria. Do you have any facts and figures around there? And what's the general attitude towards malaria vaccinations?
I think it's under development, right?
Do you want me to take that?
Yeah. Sure.
So malaria, firstly, there's never been a vaccine against a parasitic infection of humans. Malaria will be the first one. It's the lead candidate for the malaria vaccine is far from perfect. It'll have an impact on societies across the continent. It won't be perfect. It won't be the last story of the malaria vaccine. I'm sure there will be second and third generation vaccines. But there are demonstration projects that are about to start or have started in a number of countries across the continent using that vaccine produced by GSK and with the support of the Gates Foundation and many others, DFID and the European Commission, that will hopefully see an impact on severe malaria, particularly in young children and pregnant women, which is where the burden of disease is. But for malaria, there is not going to be a single intervention that solves everything. The combination of bed nets, which have had such a dramatic impact on the burden of disease in Africa, artesunate combination therapies, and vaccines when they are available and they have an impact. Those three things together, plus the engagement of the societies that we've talked about, that will be ultimately the thing that brings the malaria down from where it is today, which is increasing again across the continent.
All right, well, we're almost at our close. Do you have any further final comments or remarks you'd like to share?
I think the only thing I would say is, something like vaccines is one of the most cost-effective public health interventions that are out there. But I think we have to be conscious that complacency and fear are the greatest threats to public health. And so even though we see a level of trust in vaccines in Africa, we see the precursors of vaccine hesitancy and the mistrust in institutions. So you have to invest in vaccine confidence, as we do invest in when it comes to trust in our relationships on a daily basis. And so I think all of us have to continue to work together to ensure that in Africa, where we still have 500,000 children dying of vaccine-preventable diseases, we continue to communicate the importance of vaccines.
Yeah, and just to add, that I think this report for me has a lot of things for us in Africa in particular to think about. And I think on the good news side, there is a lot of positive perception about science and vaccines in particular, and the ability to change society, improve the quality of life. I think on the other hand, it is worrying that that people see themselves as being excluded from the benefits of science, either through the way we are doing science and the way it is being delivered to the communities. And so there's a need to really bridge that gap to ensure that the science has impact in the communities, because after all, that's why we do science, is so that you can have impact on society. So bridging that gap and figuring out strategies of engagement, of inclusivity, of improving diversity to ensure that we deliver on the impact of science and vaccines in particular is going to be very important going forward for Africa.
Lovely. Thank you very much, everybody.
Thank you.
Thank you.
It's a wrap.